Hey everybody, I just want to thank you guys for coming to my in-service this morning. As most of you guys know, I'm in my last semester of the BSN program at Bluefield State. And for our senior practicum class, we had to create a change project. For this change project, I decided that I would like to do mine on postpartum hypertension because I feel like it affects so many of the patients that we have. The goal of my change project is to decrease the number of adverse outcomes related to postpartum hypertension by providing education to all patients at risk. The objective of my project is to create a one-page handout that will be provided and taught to all patients who are discharged from the Women's Center who are at high risk for postpartum hypertension following a vaginal or cesarean delivery. The handout that you guys picked up when you came in is the handout that I created to be given to patients at risk for postpartum hypertension. So I would just like to discuss the content that is on that page. First, I just described the definition of postpartum hypertension, which is when blood pressure is persistently elevated following birth. I think a lot of the people who are diagnosed with postpartum hypertension do not even realize what their diagnosis is. So I think it's really important just to describe and define what postpartum hypertension is. Secondly, I just discussed the risk factors for postpartum hypertension, which including having high blood pressure with your most recent pregnancy, obesity, having multiples, which is like twins or triplets. I know we don't normally see triplet mommies here because they're high risk and they'll go to a different facility, but twins are pretty common. So those mommies are at risk as well. Also having chronic high blood pressure, which means that they had it before their pregnancy, or diabetes, whether it be type 1 or type 2 diabetes. Remember those risk factors and try to give that handout to those who have those risk factors, even if they haven't had a problem with hypertension pre-pregnancy or during pregnancy. You can at least give them this handout and just tell them that they are part of the people who are on the risk factor list. Next, I just listed the signs and symptoms of postpartum hypertension, which I know we all know, but I just wanted to review for the point of this in-service. High blood pressure that's greater than 140 systolic, which is the top number, and greater than 90 diastolic, which is the bottom number. If they have severe headaches that aren't relieved with medication, if they have any vision changes, such as loss of vision, blurred vision, or like light sensitivity. If they have upper abdominal pain, which is most commonly under the ribs on the right side, decreased urination, or protein in the urine. And I know they can't tell whether they have protein in the urine at home, but if they're experiencing any of the other signs or symptoms or have had protein in their urine beforehand, then they know more of what to look out for. Lastly, I just wanted to discuss the prevention and management, which is the most important part when they're going home and being discharged from the hospital. I just wanted to include that they should take their blood pressure at the same time every day. I've been recommended to all of my mommies who I discharge, take it in the morning when you get up and eat breakfast, and at dinner, so that way they kind of have a general time frame to take it at the same time every day. If they have two results that are greater than 140 over 90, then they need to call their physician's office. Or if they have them after office hours, then they can come to the nearest ER. We should always encourage them to attend their follow-up appointments. An article that I researched when I was researching my topic stated that people who have a follow-up appointment that is already scheduled for them are more likely to attend that follow-up appointment. So I just want to encourage you when you're discharging somebody and it's still during office hours to call and just make an appointment for them and then make an appointment card and put it in their discharge paperwork. So they're more apt to go to that appointment if it's already been made for them. Next, I just wanted to talk about hypertension medication. Often these people go home on labetalol, which is the most common medication. And I think a lot of people are hesitant to take medication if they don't really know what it is. So I urge you just to take a little bit more time and discuss what the medication is, what it's for, and the side effects it can have. Luckily, our Meditech system, if the doctor puts the order into our Meditech, whenever you print your discharge instructions, it prints information regarding that medication. and it lists all the side effects. So I just try to highlight the side effects and go over those whenever I'm going over their discharge information. They should also be encouraged to eat a well-balanced diet. This includes getting their daily servings of fruits and vegetables, and limiting their sodium, which I know is hard because a lot of people around here eat fast food, and more unhealthy food is cheaper than healthy food. And they should be drinking at least 8 glasses of water per day. We do have a dietitian that's in-house during the day shift, so if you think it's a good idea and somebody doesn't seem like they're wanting to eat a well-balanced diet, or even if they are wanting to but they don't know where to start, it would be easy to put in a consult for a dietitian to come talk to them so they have an idea of what they should and should not be eating. I'm going to keep copies of the handout in the drawer with the Matter of Trust booklets. It will be kept in a folder that's labeled PPHTN handout. It's a red folder. I placed the original copy in there and put it in a clear sheet and just wrote original on it. And I made 30 copies and put it in the drawer as well. I just urge you, please don't use the original copy and hand it out. And if the copies are getting low, please just continue to make them. I don't mind to make them when I'm here if I get a chance to check. Spencer locally has volunteered to make copies for me and keep an eye on it. But if we can all just together as a unit try to keep an eye on it. I will also just keep an original copy in my locker just in case something happens and the original gets used. I encourage you to please hand these out to all the people who are at high risk for postpartum hypertension, because I feel like it's an easy way for them to have information that they can use when they go home. And we can help prevent the adverse outcomes that can happen when they have high blood pressure. If there's anything that you see on there that you guys want me to change or you feel like I could do differently, please just let me know and I'll be happy to look at it and try to fix it. I just wanted to thank you guys again for coming and listening to my short info service. I really appreciate it, and I hope that you guys start using this, and I'm really excited to start handing it out to all of our patients and see how they like it. And for coming, as promised, we will do a drawing for a Starbucks gift.